anterior drawer test is a physical examination to test the stability of the knee's anterior cruciate ligament. And in the same way, posterior drawer test is to assess the stability of the posterior cruciate ligament. So let us throw some light on the anatomy, that is, what is the function of the ACL. The anterior cruciate ligament is responsible for maintaining the stability of the tibia. The ACL arises mainly from the anterior aspect of the tibial plateau and insert on the medial aspect of the lateral femoral condyle. And this ACL resists mainly the anterior translation of the tibia relative to the femur, and also it resists the rotation. Not only that, another important function of the ACL is it prevents excessive tibial, medial and lateral rotation as well as varus and valgus stresses. So, loss of continuity of the ACL, which means whenever there is a rupture of the ACL, it permits inappropriate anterior movement of the tibia and thus causes instability of the knee joint. Now, let us concentrate on the examination of the anterior drawer test. As you can see here, the patient lies supine on a plinth with their hips flexed to 45 degrees, and now the patient knees flexed to 90 degrees and feet flat on the plinth. Now the examiner sits gently on the toes of the tested extremity of the patient to help stabilize it. Now the examiner grasps the proximal lower leg just below the tibial plateau or tibiofemoral joint line and attempts to translate the tibia anteriorly in an explosive movement. And if there is an excessive anterior tibial translation more than 6 mm or more anterior translation compared to the contralateral leg, it indicates that there is an injury to the anterior cruciate ligament. Now, the care need to be taken, that is, when the anterior drawer test is done, if an audible snap or palpable jerk occurs where the tibia is pulled forwards and the tibia moves forward excessively, a meniscal lesion is likely in addition to torn anterior cruciate ligament. And this examination must be performed with the lower leg in neutral position because the start position could result in the false positive anterior drawer test. What is the meaning of this? For example, if there is a PCL instability or PCL injury, meaning whenever there is a rupture of the posterior cruciate ligament, there will be posterior translation of the tibia from the neutral position before the beginning of the test. And if the examiner performs the anterior drawer test from this position, he will notice the anterior tibial translation even though the ACL is intact, and the examiner may conclude wrongly that the test is positive, which may give false positive results. Therefore, it is very important for you to see whether it is PCL injury or ACL injury by such test. So this is what we need to know about anterior drawer test.